In general, timing is always a really big issue with joint replacement surgery. You can be kind of too old or too young. So the issue with being too young is the implants have a lifespan. They have a longevity. It's not a set in stone. It's a statistical issue. The longer they're in, you'll see more of them that need revised or that wear out. And so we prefer you to be, in your mid to late 60s or 70s. The likelihood of a joint replacement at that time period lasting you the rest of your life is very high. On the other side, if you get to be really old, if you're medically not well, if you're not strong, if you're physically just not able to recover and kind of bounce back, joint replacements are also not the best idea. So in my personal practice, I have replaced a 27-year-old knee and I've replaced a 94-year-old knee. So there's not a cutoff. There's not a you're too old or you're too young. Sometimes you don't get to choose, but we definitely have a lot more conversations around timing and why are we doing what we're doing, and making sure that we're communicating well, understanding the risks and the benefits, and kind of what we're going after. It is ultimately the patient's decision on sort of when to proceed, but we will have a different kind of level of aggression, I guess, if you will. If you're a young person, I will flog you as long as you'll let me, to try to keep you out of that surgery. If you're 80 and it's looking like all the stars are lining up against you and it's going to probably have to happen at some point, we'll sometimes pull the trigger a little quicker on kind of getting you in and getting the replacement done, just so that we don't get you to the position where it may be harder to bounce back.